Okay, hello. You're welcome once again to my tutorial sessions. Today, I'm going to be talking about the topic I term order movement disorders. The reason why I'm giving this topic order movement disorders is because in my last lecture, I delivered a session on Parkinson's disease, which is a big important movement disorder. So today I'm just going to be talking about the other movement disorders, which includes essential tremor, restless leg syndrome, Huntington disease, normal pressure hydrocephalus, and Tourette disease. So let's get started. Okay. First of all, I'll be talking about essential tremor. Essential tremor is a very important question. I've seen it in a lot of questions, including the AKT. And the beautiful thing about this topic is if you know some basic facts about essential tremor, you'll be able to get a point freely, easily off the AKT. Just a few things to know. And anytime you have a question, you can answer that question on essential tremor. So what do we need to know about essential tremor? Essential tremor is a condition that is characterized by bilateral fast upper limb tremor. This condition is inherited as an autosomal dominant condition. You get, and the tremors are worse when the arms are outstretched. But for example, if somebody that has essential tremor wants to pick a cup of wine, the tremors get worse. Although the tremors are still there when the person is at rest, but when he tries to hold something, the tremors they show up a lot. And although this condition can occur at any age, it usually starts in early life. And sometimes the voice might be affected because the vocal cords could be affected. So affectation of the vocal cords has an effect on the voice. So the treatment is propranolol. Other medications are primidone, gabapentin. It is important for us to note that even with propranolol, we don't really get very good results with essential tremor. Okay, I would just like to add before we move to the next point that essential tremor could be relieved by alcohol. Funny enough, this is one of the conditions that will be relieved by alcohol, and it could be worsened by caffeine. Okay, so secondly, we'll be talking about restless leg syndrome. Characteristically, restless leg syndrome gives a person an irresistible urge to move the legs. A patient with restless leg syndrome has an irresistible urge to move the legs. Okay, and in the world of movement disorders, it's one of the disorders we characterize as akathisia. That is, the person involved finds it hard to stay still. Okay, the person involved finds it hard to stay still. So it's the person has some spontaneous and continuous lower limb movements. There might be paresthesia sometimes. Okay, restless leg syndrome has some associations, like it could be associated with iron deficiency anemia, with uremia, with DM, that is diabetes mellitus, and pregnancy. Okay, so these are the conditions that could be associated with restless leg syndrome. What is the management? In the management of restless leg syndrome, we try to utilize things like walking, stretching, massaging, and if these do not work, we go ahead to use things like dopamine agonists like pramipexole and ropinirole. Usually, when you have a question on the AKT and it's asking about what medication will you give to a patient that has restless leg syndrome, this is the answer: dopamine agonist, pramipexole, ropinirole. Those are the answer. Okay. Other medications that can be used include benzodiazepines and gabapentin. If you look here, I've put a star on iron. Iron has a place in restless leg syndrome that is caused by or is associated with iron deficiency anemia. Okay? So I have some extra notes here. A family history could be present in restless leg syndrome, and it is of equal incidence in males and females, and it's quite common. You have 2 to 10% of the population have this condition. Okay. Now let's talk about Huntington disease. Huntington disease. Okay. There are a few things you need to know about Huntington disease. It's a kind of movement disorder that is characterized by what we call chorea. Okay. So usually I'm putting all the characteristic features in here. So I put chorea here. It's characterized by chorea, or what we call choreiform movement. Usually what happens is, having gone through all the a lot of questions in the AKT and another question banks, what I notice with Huntington disease is that a lot of times the questions, they are interested in you getting the diagnosis right. Okay, that's what we're going to focus on. What are the features that people with Huntington disease exhibit? What are the features they exhibit? Because usually what you have is a scenario. They paint a scenario for you, tell you about a 60-year-old man who has a dancing like movement. Okay, he has a dancing like movement. He has some memory issues. He has some mood changes. Okay, he's irritable. He has antisocial behavior. What is the diagnosis? Essentially, what I'm saying is Huntington disease has a characteristic set of features that you expect to see. You see dancing like movement. You see memory loss. Dancing like movement. Chorea is more or less like a dancing like movement. You see dancing like movement. You see dementia, and you see, they might tell you the patient has memory issues instead of telling you the patient has dementia. So you see dancing like movement, you see memory issues, and you see behavioral changes, which you can come in form of antisocial behavior, mood changes, or irritability. So the treatment here is antipsychotics. Okay, I've put a genetic test trinucleotide repeat sequences. So in order to make a diagnosis, a genetic test is done, which shows what is called trinucleotide repeat sequences. So I'll put it in quotes here. That's what the test review. Okay, and the age of onset is around 30 to 50 years. Okay. Normal pressure hydrocephalus. I wouldn't say much about normal pressure hydrocephalus. I would just say that when you have a question about normal pressure hydrocephalus, I think just like Huntington's disease, most of the time they are really interested in you being able to know what the diagnosis is. So they give you an elderly man or woman, usually I think a man with urinary incontinence, problems with gait or problems with walking, and dementia. Okay, so they tell you, oh, elderly man suddenly become incontinent, he has problem with gait, and he has some memory loss. What do you think is the diagnosis? Go for normal pressure hydrocephalus. You see, I just want us to note something. In the exam, questions on normal pressure hydrocephalus and questions on Huntington disease. They are interested in knowing the constellation of symptoms that the patient presents with, the most important constellation of symptoms. In normal pressure hydrocephalus is urinary incontinence, gait problems, and memory issues. In Huntington's disease, choreiform or dance-like movement, memory issues, and behavioral issues. So if you can put the three together in your questions, you know what answer to go for. Okay. So lastly, I'll be talking about Tourette disease. Tourette disease, I wouldn't say much about it, but it's a kind of movement disorder that involves, it could either be present with vocal tics like grunts, coprolalia. Coprolalia means repeated use of obscene language, okay? Or it could be motor tics like sniffing, blinking, blanking, or frowning. And sometimes you could have some obsessive compulsive behavior. Okay, so that will end the session on other movement disorders. I will encourage you, if you have not got the tape on Parkinson's disease, to get it. So I'll be saying goodbye for now. Then I'll see you